Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Bernie Clement, Vice President of Information Technology and Innovation at Terrebonne General Health System. We're going to be discussing the Digital Health Most Wired Award and what it means for our community. Welcome to the show, Bernie.
Thank you.
All right, well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
Okay, well, I'm from Chackbay, Louisiana.
Okay.
I graduated from Thibodeau High School in 1987, went to Nichols, finished my bachelor's degree at UL Lafayette, and then went on to get my MBA at Houston Baptist University. I've been in various healthcare IT leadership positions for about 20 years now. As far as my role here at the hospital, in addition to leading our information technology department, I am responsible for facilitating innovation here at the hospital, which is basically trying to discover new ways in which we can deliver healthcare to our patients here at Terrebonne.
Okay, that sounds like a very wide role of
Yes.
things, all encompassed in one. All right, well, let's get started with talking about this wonderful award. So what is the College of Healthcare Information Management Executives Digital Health Most Wired Award, and why is it important to us?
It's quite a mouthful, so I'm glad
It
you had to say
is.
what the award was. So the Most Wired Award is a recognition of who are leaders in healthcare and using computer systems to deliver healthcare. It's focused mainly on delivering surveys, so it's a survey-based report that is issued by the executives. And what they do is they'll grade all of your health systems on a maturity scale of 1 to 10, 10 being the highest, and anyone who grades out 7 or higher is considered most wired. So in the survey, they'll survey you on several factors. It'll look at clinical quality and safety. It'll look at patient engagement and satisfaction, innovation, our infrastructure, security, analytics, pop health, and even our hospital back office operations. So with the survey, we scored great most wired in both our hospital and in our clinics.
Okay, that's a lot of criteria.
It's extensive.
All right, so how many organizations were reviewed, and is Terrebonne General the only one in the region or the state to win this award?
Great question. So there's 55,000 health systems that participate in this survey every year. So with us, we reached a level 8. So with us reaching a level 8, we're one of only 250 health systems in the country that are at that designation. And as far as the state, there's only 2 other systems that reached level 8 in both the hospital and the clinics, FMOL and Ochsner. And if you're familiar with those systems, that's huge systems, multi-hospital, vast resources to dedicate to IT. Terrebonne General is the only freestanding service district hospital to achieve this designation in the whole state. So it's pretty cool.
That says a lot for the amount of time and effort that goes into technological resources here. So tell us more about that. What current technologies are being used at Terrebonne General, and why are they so innovative?
So before I talk about a few technologies, I think the key that differentiates us is how much we focus on innovation at the board level and leadership level, as well as our IT staff. Very committed, very hardworking. I think that's what makes us different. Other than that, all those technologies are just a bunch of hunk of metal, right? But it's our interest in being innovative and finding new ways and challenging ways to deliver healthcare. I think that is great here. A few key technologies that we deploy. Epic is used here in the health system. If you're not familiar with Epic, it's the industry-leading EMR vendor, electronic medical record vendor. So we use Epic for our patient records as well as our patient portal. So hopefully our audience is familiar with MyChart, our patient portal. If you're not, you can download it by going to the App Store on your phone and looking up Epic MyChart. But our patient portal is key in having our patients interact with their information as well as interacting with their healthcare provider. Beyond Epic, though, we've just recently deployed BioFire in our lab. BioFire allows us to now identify bacteria strains within hours versus historically something that would take days and delay the delivery of healthcare to a patient. We also have a new robot in our pharmacy. You can imagine how much medication gets distributed and how difficult that could be in a hospital. Well, we have a robot helping us with that in our pharmacy. And then the final thing that we're deploying now is Workday. Workday is the industry-leading ERP vendor, so enterprise resource planning. With Workday, we're going to have new workflows and better technology in both our human resources, financial, and supply chain departments.
Very interesting. Very interesting. So can you tell us, why is this so important for patients and our community?
Well, I think our patients and community expect us to evolve as they're evolving. As you can imagine, the majority of people here in the parish, they use their smartphone to get reminders. They use social media to keep up with friends and family. They use Amazon to be able to shop. They use Google to be able to find answers to questions they don't know. Well, they do all that because they hate waiting, right? So that's, I think, what they expect of healthcare. Waste-free, wait-free, technology-driven healthcare that is still very personable. So that's why I think, it's important to them. And some of the key things we're doing around that, we've deployed FastPass. FastPass allows a patient to get an alert whenever they can come to an earlier appointment. We have also went to completely digital check-ins. So now you can go ahead and register and do all that paperwork before you even come to your visit. We're deploying Care Connect Plus. Care Connect Plus allows us to have a nurse interact with that patient via video to assist them in organizing their admission and their discharge. So in addition to that on-unit nurse that will never go away, they're facilitating that patient as well from a video mechanism. And then finally, we've deployed Growing Wisely. Growing Wisely is allowing us to be sure that we can have the most efficient workflows through using performance improvement technologies.
Well, Terrebonne General sure is on the cutting edge, the leading edge of technology. Thank you so much for being with us today and sharing all this helpful information.
Thank you.
For more information about innovation at Terrebonne General Health System, visit tghealthsystem.com. Thank you for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.